As your due date comes and goes, you might find yourself wondering, why is my baby overdue? The anticipation of meeting your little one can be overwhelming, and when your baby doesn't arrive on schedule, it's natural to feel anxious or frustrated. However, a post-term pregnancy, defined as lasting beyond 42 weeks, can be perfectly normal and is actually more common than you might think. In this guide, we'll explore why some babies are overdue, what it means for your pregnancy, and what steps you and your healthcare provider can take to ensure a safe delivery for you and your baby. What is a post-term pregnancy? A full-term pregnancy typically lasts about 40 weeks, but when a pregnancy extends beyond 42 weeks, it is considered post-term. It's important to note that many babies are born healthy and well after their due date. In fact, about 5 to 10% of pregnancies go beyond 42 weeks. While being overdue doesn't necessarily mean there's a problem, a post-term pregnancy does require closer monitoring to ensure the health and well-being of both you and your baby. Why is my baby overdue? There isn't always a clear reason why some babies are overdue, but several factors can contribute to a longer pregnancy. Here are some possible explanations. Number 1. Incorrect due date calculation. One of the most common reasons for a pregnancy to be considered overdue is an incorrect due date. Your due date is typically calculated based on the first day of your last menstrual period. However, if you have irregular cycles or don't remember the exact date of your LMP, the due date might be off. Ultrasounds done in the early stages of pregnancy can provide a more accurate estimate, but even these aren't foolproof. Number 2. First-time pregnancy. First-time pregnancies often last longer than subsequent ones. If this is your first baby, it's possible that your body is simply taking its time preparing for labor. First-time mothers are also more likely to experience a longer pre-labor period, where the body is slowly getting ready for the big event. Number 3. Family history. There may be a genetic component to post-term pregnancies. If your mother or grandmother had overdue pregnancies, you might be more likely to experience the same. This suggests that your baby's gestational length could be influenced by hereditary factors. Number 4. Hormonal factors. Hormonal imbalances can sometimes delay the onset of labor. For example, issues with the placenta's production of certain hormones might slow down the signals that tell your body it's time to give birth. However, these cases are rare and usually identified through careful monitoring. Number 5. Previous post-term pregnancy. If you've had a post-term pregnancy before, you may be more likely to have one again. Some women's bodies naturally tend to carry pregnancies longer than the typical 40 weeks. Number 6. Baby's position. The position of your baby can affect when labor begins. For instance, if your baby is not in an optimal position for birth, or such as being in a posterior or breech position, it could delay the onset of labor. This is why some healthcare providers may suggest exercises or techniques to encourage the baby to move into the right position. Number 7. Stress and anxiety. Emotional factors like high levels of stress or anxiety can sometimes play a role in delaying labor. While this isn't always the case, feeling anxious about the upcoming birth might unconsciously affect your body's readiness for labor. Relaxation techniques such as deep breathing exercises, prenatal yoga, or meditation can help you manage stress and may even encourage labor to start. What are the risks of a post-term pregnancy? While many post-term pregnancies result in healthy babies, there are some risks associated with going past 42 weeks. These include: Number 1. Decreased amniotic fluid. As pregnancy progresses beyond the due date, the amount of amniotic fluid can decrease. Low amniotic fluid levels can lead to complications such as cord compression, which can affect the baby's heart rate and oxygen supply. Number 2. Placental insufficiency. The placenta is responsible for delivering nutrients and oxygen to your baby. In a post-term pregnancy, the placenta may start to age and become less efficient, which could lead to decreased oxygen and nutrient supply to the baby. This condition is known as placental insufficiency and requires close monitoring. Number 3. Increased birth weight. Babies born after 42 weeks are more likely to be larger macrosomia, which can make delivery more difficult. Larger babies have a higher risk of shoulder dystocia, where the baby's shoulder gets stuck during delivery, and this can increase the likelihood of needing a cesarean section or assisted delivery. Number 4. Meconium aspiration. Meconium is the baby's first stool, which is usually passed after birth. However, in a postpartum pregnancy, there's a higher chance that the baby may pass meconium in the womb, which can be inhaled into the lungs during delivery, leading to a condition called meconium aspiration syndrome. Number 5. Stillbirth. While the risk of stillbirth increases slightly after 42 weeks, it's still relatively low. However, because the risk exists, healthcare providers often recommend closer monitoring or induction of labor after 41 weeks. What can I do if my baby is overdue? If your baby is overdue, it's important to stay in close contact with your healthcare provider. Here are some steps you can take. Number 1. Increased monitoring. Once you reach 40 weeks, your healthcare provider will likely increase the frequency of your prenatal visits. They may perform additional tests, such as non-stress tests, biophysical profiles, and ultrasounds, to monitor your baby's well-being and check the levels of amniotic fluid. Number 2. Inducing labor. If you reach 41 or 42 weeks, your healthcare provider may discuss the option of inducing labor. Induction involves using medications or other methods to stimulate contractions and initiate labor. Common methods of induction include membrane sweep. This involves your healthcare provider sweeping a finger around your cervix to separate the membranes, which can release hormones that may start labor. Medications. Prostaglandins can be used to ripen the cervix, while oxytocin or pitocin is commonly used to stimulate contractions. Breaking the water. If your cervix is already dilated, your healthcare provider may break your water or amniotomy to help start labor. Number 3. Natural methods to encourage labor. While there's no guarantee that these methods will work, some women find that natural techniques can help encourage labor to start. Walking. Gentle exercise like walking can help your baby move into the correct position for labor and may stimulate contractions. Nipple stimulation. This can release oxytocin, the hormone that triggers contractions. Sex. Semen contains prostaglandins, which can help soften the cervix, and orgasms can stimulate contractions. Acupuncture or acupressure. Some women find that these traditional methods help trigger labor. Number 4. Stay calm and patient. As difficult as it may be, try to remain patient. Stress and anxiety won't help the situation, and your baby may simply need a little more time. Surround yourself with supportive people, practice relaxation techniques, and take comfort in knowing that your healthcare provider is closely monitoring your pregnancy. Final thoughts. Having an overdue baby can be a stressful experience, but it's important to remember that most postpartum pregnancies result in healthy outcomes for both mother and baby. Understanding the reasons why your baby might be overdue and knowing the potential risks and options available can help you navigate this period with more confidence. Stay in close communication with your healthcare provider, follow their advice, and take care of yourself during these final weeks. Before you know it, your little one will be here, and all the waiting will have been worth it.